The science behind it is best explained using a computer metaphor, which is just every bad thing that ever happens to you is like a malware program that gets downloaded into your acupuncture meridians, uploaded through your nervous system into your brain, and there's a limbic system that controls all your emotional memories in files. And each file has a story, this terrible thing that happened. That's the title of the file. Then there's a story. Then there's this program that will run your body back to the original experience. And like if you're a military veteran having a PTSD flashback, it's like you're right back there in the battlefield. And so what we do with tapping is just intentionally open one of those files, say the name, and do it in a controlled fashion, and then have the program start to run. And then you're like hitting the delete key on the acupuncture points on your face and your chest as if you're uninstalling the program. And after 5 or 10 minutes, you go back up and check the file, and you'll see that picture. There'll be a story there, but the program will be gone. And you know, when you save a computer file, it's not the same as it was when you started out. So if you save that file and it's got these pleasant tapping sensations in it instead of the gut-wrenching, PTSD experience, that's what you're left with. And there's the technical neurophysiologic term for that is memory reconsolidation, which means the latest neurological theories think that every memory is only as old as the last time you looked at it.
Welcome to the podcast that guides men to demystify and develop their intuition. I'm your host, Doug Bites. Let's dig into the science and expand your horizons. My guest today is Dr. Larry Burk, a holistic radiologist whose work powerfully bridges dreams, intuition, and physical healing. He's known for his published research on warning dreams that can precede medical diagnosis, including a groundbreaking study on breast cancer dreams featured in his TEDx talk. A co-founder of Duke Integrative Medicine and a certified energy health practitioner, Dr. Burk helps people heal through tools like EFT Tapping, dream work, and mind-body awareness. His career is a fascinating example of how intuition and medicine can work together, and how listening to the inner world can change and improve the outer one. Dr. Larry, welcome to the podcast.
Glad to be here, and I'm always curious to see where a podcast goes because I never know.
Exactly, yeah. And today I'm hoping we just let the intuition flow and we see where we go. So my first question is, and you're the only person I've ever heard described as a holistic radiologist. Please explain that one. I get it, but explain to the audience.
I coined that term in my first book, which was Let Magic Happen, Adventures in Healing with the Holistic Radiologist, back in 2012, because my career in radiology led me down this holistic path in an unusual way, and that my MRI patients back in the 80s were claustrophobic, so I learned hypnosis. And then I was on the National Safety Committee for MRI, and we're looking at the health effects of electromagnetic fields. And I joined the Bioelectromagnetic Society, read Robert Becker's book, The Body Electric. And in the middle of that book, there's a chart of an acupuncture point with a skin resistance map around it, because the NIH gave him $1 million to find out how acupuncture works. So one of his grad students discovered there was a drop in skin resistance at the acupuncture points. And when I finally took the ECLA course 10 years later, they sold us a point finder, which you just go down the meridian, it would beep when you go over the points. So, and the subtitle on the chart was Acupuncture as an Objective Basis in Reality. So those holistic interests came together for me when I co-founded the Duke Center for Integrative Medicine, and then eventually discovered emotional freedom techniques, EFT tapping, which is a great combination of acupuncture and hypnosis. So that's sort of how I got here. Now there are another dozen holistic radiologists. We've had one informal meeting of 3 of us once. And about a third or more of us have written some kind of holistic book. So anywhere from hypnosis to healing environments in your house and electromagnetic fields, and it's quite a variety. So
Okay. And so as a radiologist, I'm trying to remember whether when we spoke previously, you mentioned it or I heard it on a podcast you've been on. How many like CT scans, MRIs and all that have you done in your career?
oh yeah, so I started initially with CT scanning during my residency, and then was in the ground floor of MRI in 1985, 86, and calculated that I'd read about 60,000 MRI scans in the last 40 years. So that's enough for one lifetime. So.
Right. So I was just trying to get the point across to the listeners there that you are an average Joe normal radiologist. Like you didn't just do it for 6 months and then went off to somewhere else. You've done it for your whole life. But you now add these other modalities. Because typically to me, a radiologist is one who is there when the testing occurs with the equipment, and then you interpret the results and you send a written report
and a lot of times the radiologist is not even present. It's usually the radiology technologist who is taking the x-rays. If it's a procedure that you're doing, the radiologist will be there doing the procedure. And that's where the hypnosis comes in, where you help people who are anxious get through a procedure, whether it's an MRI scan or sticking a needle in their joint.
Yeah, I've been in the MRI once or twice, but I definitely had no one there to talk me politely through it. And, but I can see the strong advantage of that with the potential claustrophobic feel, etc.
Back in the early days, a woman published a poem called "Ode to an MRI," describing it as a coffin that makes noise,
and a horrible noise at that. Yeah,
mm-hmm.
I've got hearing loss, but it's all in the high frequencies, and to me, the MRIs are a low drone, and the MRI it stands for like magnetic resonance or something like that.
Resonance imaging, yes.
And so here's an interesting one for you that I don't know if you're aware of. I was a professional firefighter, and I now 2 days a week do fire safety training. We actually have my boss has a fanatic with having every different type of fire extinguisher there is on display in our training room. And there's one there that's made for hanging around MRI machines because
Certainly.
It's not made out of metal, like steel. So it's not.
It's made out of aluminum, yes.
Yes, so that the magnetic forces don't suddenly suck it up against the wall or something.
And unfortunately, at least one person has died from someone bringing an actual oxygen tank into the room and having it fly across the room like a missile. And they have careful screening processes, but sometimes they break down. On the early days, we had a janitor who came in to buff the floors after hours, and he thought the magnet was turned off. Well, a superconducting magnet's always on, so the floor buffer got sucked into the MRI scanner, which was not recommended. And it's an interesting environment to work with. Speaking of aluminum, well, first of all, we'd do a wrench trick for demonstration purposes. You tie a wrench to a clothesline to a far wall, and the wrench just hangs there in midair like this, and you can flip it back and forth in the field. But since aluminum is not attracted, you can take a sheet of solid aluminum metal and you put it in the machine, you stand it up and let it go, and it falls like this. It goes ooh, in slow motion because it does conduct electricity, and when it moves, it generates electric currents inside the aluminum piece, which resists the pull of gravity, and so it falls like that. And if you grab the piece and move it around, it feels like you're underwater. It's very fascinating.
Wow! So it's moving slowly. So it's mildly, very, very mildly affected. Wow, that's.
I mean, it's a strange environment to work in, and my first office in my career was right next to the MRI scanner, and it was back in the old days of CRT, tubes for your computer. And my screen was like bent like this because the beam coming out of my CRT cathode ray tube was affected by the being inside that field.
So it distorted your computer monitor.
It did, yeah. Mm-hmm.
Oh, and so there's nothing to see here. People because we can't see anything going on, like there's like EMFs and stuff like that. Like wow.
That's why my favorite book on the subject is called The Invisible Rainbow, and that's a book is a tour de force of all the electromagnetic effects on life. And Arthur Furstenberg wrote that, and it's like 1,000 pages long, and it's got about 150 pages of references, just everything in the literature, every. It's an amazing book.
So he was the original conspiracy theorist on the whole thing.
He documented it all with the mainstream scientific literature. It's very well done. So
yeah, well, we might get to that a bit more after. I'm curious now, EFT tapping. I've never actually formally done a class, but I'm familiar with it and that sort of thing. And I'd like you to talk about that. What's the science behind EFT? Why does it work? What's happening?
Well, it's ironic that you're asking me from Australia, because the world's leading scientific authority is Peter Stapleton at Bond University on the Gold Coast. So,
and that's where I came across you, and she's just up the road. Like she's her university's a 30-minute drive from my house, and I would love to meet her one day.
Yeah, she's the I call her the pixie queen of EFT research. She's about 5 feet tall, a bundle of dynamic energy, and just has changed the field dramatically in the last 10 years. And she's the only full professor in an academic university doing EFT research. So we're so grateful to have her. Now, the science behind it is best explained using a computer metaphor, which is just every bad thing that ever happens to you is like a malware program that gets downloaded into your acupuncture meridians, uploaded through your nervous system into your brain, and there's a limbic system that controls all your emotional memories in files. And each file has a story, this terrible thing that happened. That's the title of the file. Then there's a story. Then there's this program that will run your body back to the original experience. And like if you're a military veteran having a PTSD flashback, it's like you're right back there in the battlefield. And so what we do with tapping is just intentionally open one of those files, say the name, and do it in a controlled fashion, and then have the program start to run. And then you're like hitting the delete key on the acupuncture points on your face and your chest, as if you're uninstalling the program. And after 5 or 10 minutes, you go back up and check the file, and you'll see that picture. There'll be a story there, but the program will be gone. And when you save a computer file, it's not the same as it was when you started out. So if you save that file and it's got these pleasant tapping sensations in it instead of the gut-wrenching, PTSD experience, that's what you're left with. And there's the technical neurophysiologic term for that is memory reconsolidation, which means the latest neurological theories think that every memory is only as old as the last time you looked at it. So if you changed it, not the same as it was 20 years ago or whatever. So,
wow, I love everything in the unseen realm, and I study and listen to heaps of stuff, but I've never heard anything described how you just described it. Then that was fantastic. Thank you for that.
And people love computer metaphors these days,
yes,
so it works.
Yeah. And I find myself, I did a lot less formal schooling than you would have. And so I have to dumb things down to my level so that I get it. And I was just imagining there, as you were talking about the tapping, instead of the tapping, I'm imagining it was like a tin can with like a lot of holes in the bottom, and you just spent 5 minutes shaking it, and you were shaking out all the little bits, and they all just fell to the ground, but you couldn't do it in 2 seconds. You had to keep tapping. You had to just keep shaking that old tin can with the holes, let that memory just fall out. And it's there. The tin can's still there with the label on, but it's now empty. There's no charge in there anymore. There's no weight. It's light. It's gone. Guys, if you're on a path of developing your intuition, and I know you are, that's why you're listening here, then the Neurovisor is a tool worth checking out. It uses light and sound to guide your brain into deeper states of awareness, helping you quiet the noise, tap into your inner knowing, and strengthen your intuitive muscle. And who doesn't want that? There's no pills, no fluff, just 11 minutes a day to reset your mind and reconnect with your instincts. I've bought myself one last Christmas, and I've added it to my daily practice, and the shifts are real. This is not a paid ad. But if you use the link in the show notes for more information, I do receive a small percentage of the purchase price. I highly recommend you check it out.
And speaking of shaking, I actually do incorporate shaking into my protocol, in that after we do the tapping, have people breathe in their favorite color, the healing color, and then breathe out the color that relates to their traumatic experience, and have them do that with their eyes closed, and then imagine the colors coming down your arms, out your fingers, and dripping out your fingers with your favorite color, and then actually shake that out of your fingers, and then let it go down your legs, removing any of the dark, stressful colors out into the ground, and stomp your feet. And it's like hitting the reset button on your body. And that really, sometimes people really get in. I just say, shake until you've let go of everything you need to let go of. And it that stems from my experience doing holotropic breath work, where I do wind up shaking a lot when I do a lot of breathing.
Yeah. Actually, I know the first time there's a group here on the beach, on 6 o'clock on a Sunday morning, they do breath work and stuff like that. It's for free. So 40 or 50 people will turn up. And the first week I went and started doing it, I was just laying on my towel on the beach, doing the breathing. And then just suddenly my upper body started sort of shaking uncontrollably. I was quite taken back. And the instructor just came and just gently popped his hands on my shoulders, and it stopped. And then he wandered off, and then it started again. But I did think later, I'd read another book. Can't remember the name of it now. But I did hear that the shaking is actually quite a valuable sort of thing.
Yeah, that's probably Peter Levine's book,
Yes.
Waking the Tiger. Yes.
Yeah. Was he the one who got hit by the car?
I can't remember his particular story, but he uses the example of a bird that flies into your window and gets knocked out and falls to the ground. Then you see if it's not dead, it wakes up, and then it's fluffs all its feathers and then flies off. So it's like, that's a way of shaking off the trauma. And that reminds me of another book, which is Bessel van der Kolk's The Body Keeps the Score. And you got to get the trauma out of your body, or the body holds on to it. It doesn't matter how much talk therapy you do. If the body still believes it, you can talk yourself till you're blue in the face. So.
Yeah. And quite a few years ago too, I read a book. Oh, gee, I wish I was prepared for this one. Eileen McCusack on. She uses tuning forks.
Tuning forks. Yeah. I met her once a while ago.
Yeah. And I went and did a 3-day class on that. I didn't continue with it. I've had sessions on myself. I know it works extremely well. I didn't continue.
I still have my tuning forks, but I don't use them. What can I tell you?
Yeah, I've got them. I lost confidence in myself physically because of my hearing, because it's intuitive, but it is also, you're hearing the different resonance and the tones in the forks when you strike them, where there's energy stuck and when it's been released. And I just... That they kept telling me that you didn't have to hear properly, but I didn't have faith in myself enough to continue it. But I really enjoyed the 3-day training, and it gave me a whole different level of thought process on how to understand the science of it and that sort of thing. Because I love woo-woo stuff, but I know behind the woo-woo is science. It's there, so I try and bring it out, and that's why I love to talk to people like you to get.
Woo-woo is science we don't understand yet. So.
Sorry, woo-woo and science.
Woo-woo is science we don't understand yet.
Yeah, but and that most of the time you can explain it, I believe, in a scientific way, or with an analogy that helps us get through it. Yeah. So, intuition and men in the same sentence. Your thoughts, like, do they go together? Were men once more intuitive than they appear to be today? What do you think?
Well, some of the most famous intuitives in history are men. I mean, Edgar Cayce, Nostradamus, but of course the catchphrase is women's intuition. And the one thing I have a story from a friend of mine who is she's psychotherapist who does some of Peter Levine's work with somatic experiencing, and her husband is an executive coach. And her husband is a member of the Jung Society, has all these epic dreams that he shares, interprets with the group. And my friend is like, I just never have any good dreams. And I'm going, okay, so you're feeling like somehow you're lacking something that your husband has in the dream world. And I said, so what's he like during the day? Is he very intuitive? Oh, no, he's really linear, left brain. I said, what do you like? Oh, I totally go by my intuition. I said, well, you obviously don't need those dreams, and that's his way of setting his left brain aside to tap his intuition. So that's interesting to think about. And obviously, a lot of the medical intuitives I've worked with have been women, but there are some talented medical intuitives who are men too.
Yeah. And, I believe if you go back to, many, many hundreds of years ago, back to the hunter-gatherers, if you and I were about to go hunting for the day or for a 2 or 3 day trek, you'd be thinking, well, the end goal is here. We come home with some serious food for the tribe. And what's our best chance of, tapping into these very intelligent animals who have very highly attuned senses to sense danger? And how are we going to, so we're going to have to be, you're going to head on, we're going to get out of earshot of each other. We're going to have to be in intuitive connection with each other so that one of us doesn't scare the animal off, and et cetera, et cetera. So, yeah.
And I think that gets back into the shamanic roots of intuition. And Stanley Krippner, who's a famous authority on shamanism, lectured for us here at the Rhine Research Center years ago, and he said there are 5 Ds of shamanism that you need to know about, of ways of getting into an altered state to access that information. So I'm going to ask you if you can guess the 5 Ds of shamanism. I've already told you one. Things that begin with a D that people do to get into an altered state.
No, I've just gone no.
So I already mentioned dreams. Okay, dreams.
Right.
That's the first. What else do are shamans known for?
Drumming.
Drumming. There you go. You got 2.
Yeah. Yeah.
I mean, sacred plant medicine, you could call drugs. Okay.
Yeah, true.
Drugs. Okay, drugs is the third one.
Yeah. Okay.
And then there are 2 more.
Dreams, drumming, drugs.
Drugs, yes. And this one comes from my guy I met called Bradford Keeney, who wrote the book Shaking Medicine. It's the ecstatic power of movement. So dancing, yes. And that's like he worked with the Kalahari Bushmen, who were known for dancing themselves in an ecstatic state. And the last clue comes from what the Lakota tradition is called the vision quest, where you go out, they put you on a mountain for 4 days and 4 nights with no food and no drink and no contact. And that's deprivation. Okay.
Right. Okay.
So those are the 5 ways of getting into an altered state and accessing your intuition.
Yeah. Okay. And then I guess what the CEOs, et cetera, of the world these days would then want an executive coach to, like, how do I do that in a sane looking way so I'm not dancing in my office?
Well, they would probably just do microdosing.
Yeah, true. Microdosing with mushrooms and a bit of shaking when the door's locked, and yeah. And so deprivation, would that be fasting or?
Fasting, I mean, they're completely cut off for 4 days, so, and not only fasting from food and drink, but from any human contact or, and also lack of sleep. You're out there, people don't sleep very well when they're out there by themselves.
So it's a bit of a rite of passage as well.
That's what it is.
Yeah. Interesting. Very, very interesting. And now you talked earlier about EMFs. I'm just curious, are EMFs just frequencies that aren't compatible with the human energy system? Is that the main problem, or is there other problems?
EMF is just the entire spectrum. It goes from ELFs, or extremely low frequencies, which are like power line frequencies, 60 hertz, up to X-rays and beyond that are, giga, tetra, hertz, way up the field, and the faster the frequency, the shorter the wavelength, and the higher the frequency, the more damaging it is potentially to your chromosomes. So, but there's also health effects from extremely low frequency fields. People living around power lines have some deleterious effects as well. So.
Right. And so each different frequency is going to cause a different problem in the human body. So therefore
Yeah.
it's hard to nail down that EMFs cause, because for one person, EMFs caused, their left earlobe to fall off, something, I'm being ridiculous,
Yeah.
but for someone else, they've been exposed to a whole different frequency range, and it's caused a problem with their right knee. And it's like, so then the powers that be say it doesn't correlate. It's, but
Well, and there probably are certain frequencies that are beneficial and other ones that are not. And there have been basic science studies showing, oh, this is the frequency for nerve regeneration. This is, different frequencies. And then I just finished reading a book on chakra dream diagnosis, chakra dreams. And she quoted some studies saying that there's a different frequency for each chakra, from around 200 hertz up to 900 hertz as you go up the chakras. I don't have any proof of that, but it's an interesting idea.
Yeah. Okay. So we need to expose ourselves a lot less to what we've become aware of that are harmful, but they're not all harmful, because obviously some frequencies are beneficial to us.
And just for example, the basic science, my friend Carl Blackman was the EPA's lead EMF researcher, and he found if he put a preparation of chick embryo brain cells in a petri dish and tested how the calcium moved in and out of the cell membrane, he could, and this was a Faraday cage, a Crawford cell I put it in, that he could control the background magnetic field that the preparation was exposed to. And also he could send in a particular frequency, and he was interested in the power line frequency. So he would put in, remember, the Earth's magnetic field is only half a Gauss. So the MRI scans that I work in are 15,000 Gauss. So it's like extremely strong fields versus the Earth's field is very, very weak. And it does fluctuate in different places around the Earth. And so he put this preparation in there, and he pulsed it with the 60 hertz field cycles per second, and at half of the Earth's field, half a Gauss, the brain cells would release the calcium, and that would potentially have a physiologic effect. Then he, in the controlled environment, he turned the background magnetic field up to 1 Gauss, so doubled it, and the effect went away. But it came back again at 120 hertz. So that's the phenomenon of resonance. Is like when we do MRI, we're working with a 15,000 Gauss field, and the frequency we send in to make your hydrogen protons spin around properly to make a picture is 63.9 megahertz, which is similar to what you might get on your UHF or VHF TV channels. So the whole room that the MRI scan is in has to be shielded in copper, so those radio waves and TV waves don't come in and mess up the picture. But now they're coming out with 3 Tesla magnets, so twice as strong. So the frequency they put in is now 128, 129 megahertz. So because that's what makes the hydrogen proton spin in resonance.
Yeah. You just reminded me when you're talking about they have to shield the room in copper to stop those external ones upsetting the MRI machine. When I was a teenager, we lived about 2 miles as the crow flied from the main hospital. And we'd be sitting watching TV at 7 o'clock at night, old black and white TV. And we would go beep, 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 right in the middle of the show. Dr. Smith, Dr. Brown, whatever, code code purple, room
Yeah.
305 or something like that. It was the local hospital coming through It's like, with their paging system. It was crazy. And it wasn't until we got a color TV that it stopped. Obviously, the transistors in the old black and white just were set for that frequency. And
Well, there
yeah.
was also a crazy TV show from about, it's got to be 30 years ago, about the Kalahari Bushmen called The Gods Must Be Crazy. And I
Hmm.
don't know if you remember this, but a radio gets dropped in the jungle, and the Bushmen find it, and they start turning the dial, and all these different voices are coming out of it, and they assume that the box itself is making all the information come out of it. And the concept that it would only be a transducer picking up everything around us and turning it into information is completely foreign to what they think. The box is God, it's making all this stuff, whereas we know it's just a transducer. And of course, that's the big debate in consciousness research that goes back to the days of William James, who basically said the brain is a transducer. It's not the producer of consciousness. It's merely tapping into all the conscious fields and then downloading it so that you can make some sense out of it.
Yeah, that's very interesting that. Now, something else that you've co-authored a book on warning dreams. So I just thought we might cover that a little bit. And so how do we get from radiology into the dream world? How did you?
Well, I was trained in mammography for a year or two, but I haven't read mammograms in 30 years. But uh, one of my best friends in around 2004 or 5 told me that she'd had this really vivid dream where she is laying on an operating room table. A woman surgeon is operating on her breast, and she has breast cancer in her left breast. And very convincing dream, And so she goes in the next day to get her mammogram. She's about 50, and she has relatively dense breasts, which makes it harder to find a cancer. And the radiologist comes out to reassure her, and she says, look, you can come back in 6 months. There's nothing going on. She didn't have a lump. She didn't have any symptoms. And my friend is not reassured. She goes, no, I'm pretty sure I have cancer. And the radiologist goes, oh, how do you know? I mean, it doesn't make any sense. She said, well, I'm not going to leave until you do an ultrasound to double check and see if you can find the cancer. Now, ultrasound is not a very sensitive test for finding breast cancers, or they would do it all the time first on everyone, but it does occasionally work. So the radiologist kind of rolls her eyes and she goes, look, I wouldn't even know where to begin, and my friend just goes, well, just do it right here on the left breast. And the radiologist just puts the transducer on, and sure enough, there's a 1 centimeter solid mass deep in her breast, which is not a cyst. And the radiologist turns white as a ghost and goes, well, how did you know it was that? And that's when she told her it was a dream, not before. And then she got referred to for a breast biopsy by a surgeon, and she walks into the office and she recognizes the woman surgeon from the dream. That was a week or two later. And so that was the beginning of my journey when she shared that story with me. I thought, well, this must happen to other people. So I started looking for other examples. And then I found another friend who's a physician, had a similar story. She had a dream about 2 dreams. One was about a serial killer, you like to get up and make sure your doors are locked. And then the next dream was about having breast cancer. She went in and she had relatively fatty breasts, so they found the breast cancer on the regular mammogram. And then a third friend was a British woman who had the dream, even had a few little symptoms, went to her doctor. The doctor dismissed it. Nothing to worry about. Didn't even get a mammogram. And she died of metastatic breast cancer a few years later. So that got me started on this whole journey I sent a survey around the world looking for other women who had the same experience. And I wound up with 18 people who reported similar experiences. And many of them had a a guide come and tell them, and the guide could have been a relative of theirs, like grandmother who had died of breast cancer, or often a white-coated healthcare professional who they would often meet later on in the course of their therapy. One of the other women, the 18 women, happened to be this dynamic woman who has her own book agent, her own publicist, and she convinced me to write the book together with her. And her story was really phenomenal. And her sort of a picture that looks like hers on the cover of the book. And she would have these really unique dreams where you're having a dream, like a regular dream, and all of a sudden it would freeze. The whole thing would freeze frame. And you know, when you're working on a computer, you hate when your computer freezes. And then she would have a pop-up window appear, and nobody likes pop-up windows either, you know. So pop-up window appears, and then this Franciscan monk would step through the pop-up window and give her
instructions. This is in her dream.
In her dream, the pop-up window, Franciscan monk with a robe, leather belt, sandals, everything. But he was hooded, so she could never see his face. And they would say, "You've got breast cancer. Go get a mammogram. Go get an MRI scan. Go to your doctor." And she went through all the tests and still they couldn't find any problem. And she finally, the monk said, you're gonna have to get a biopsy no matter what. So she convinced the surgeon to biopsy her breast without having any guidelines, and they found the cancer. So
wow. And so that's fascinating. And I have listened to the book, like the ebook, as I've been driving in the car over the last couple of weeks. Fascinating. So other types, I mean, so obviously for breast cancer there, that was what first alerted you to these sort of things. And then other people with other types of issues.
Yeah, and when I started collecting cases, I was giving a TEDx talk, and I was starting to collect other cases, and two of my friends shared their stories. One was one of my favorite MRI techs, who said, "Oh yeah, I had a dream a few years ago about having." It was a strange dream. She was like 58 years old. She'd been through menopause, but the dream was about she was giving birth. And she thought, well, that makes no sense. It's impossible. And she said, she's an artist. She must be giving birth to her next project. But she was also a talented dreamer, and she knew better than to ignore a potential warning. So she asked for what we call a clarifying dream the next night. And I have people write down in their dream diary, it's like, I don't understand. Well, how could I be giving birth? You know, and then she has this dream where she's taken to a graveyard in Ireland, shown a headstone with her name on it, surrounded by daisies, and a voice in the dream says, if you don't take action on that dream last night, you're going to be pushing up the daisies soon. And so she went right to the gynecologist. They did an ultrasound, and she had an endometrial cancer in the uterus. Wow. And the choices in terms of surgery are you can either have an abdominal incision and pull it out like a C-section would be in childbirth, or you can do what's called a vaginal hysterectomy, where they expand the vagina and they pull the uterus out through the vagina. It's called a vaginal hysterectomy, which is what she had done, which is like giving birth to a tumor.
Oh, wow.
So that was part of one of my TED talk, and my TED talk got banned because the TED officials decided that was outside the realm of their comfort zone. So and then my other friend was high school friend I hadn't seen in decades, and she told me, "Oh, I started having dreams about blood in the toilet every night." Very disturbing, you know. And it's like she wasn't having any bleeding, and she wasn't sick, and so she said, it must be something wrong with my colon. So she went for a colonoscopy, and they found a stage 3 colon cancer that had already started to metastasize. And fortunately, they got all the lymph nodes out, and she's fine 10 years later. So that dream definitely saved her life. So.
Yeah, wow. That's pretty serious. So it's a good wake-up call. So if anyone listening has had dreams, medical dreams, or knows somebody that's had a medical dream, Dr. Larry's book would be pretty handy to read, or would hopefully encourages you to act on things like that.
Yes, and keep it. I mean, keep a dream diary. It doesn't cost you anything. And I always tell people, if you do get what seems like a health-related dream, ask two questions: is it a dream about a physical problem, or is it an emotional metaphor for some imbalance in my life? And there was an example of that from when I presented this at the International Association for Study of Dreams. This woman came up and very adamantly said, I had a client who vivid dreams of cancer in her groin, and on the one side of the groin, and they had an MRI scan, an ultrasound, a CT scan, and they couldn't find anything. And then she realized, well, my boyfriend is a Cancer astrological sign, and he was behaving somewhat malignantly. So she dumped her boyfriend as a result of that dream. Now, you might ask, what if she'd have married the guy? Would she have gotten a cancer there? We don't know. So that's and the most popular exposure of this whole phenomenon came through a famous Hollywood actor, Mark Ruffalo, who plays the Incredible Hulk in the Marvel movies and many other movies. And back at the beginning of his career, I don't know what some early movie he was making, he dreamed that he had a brain tumor. Oh, no. And it was very vivid. And he came in and told the Hollywood doctor who helped with the actress that he's got a brain tumor. And the guy goes, another crazy, actor who's got a hypochondriac situation. So, but he got a CT scan to humor him, and he had a golf ball sized tumor on his inner ear that was pressing on his brain, called an acoustic neuroma, which is a benign tumor, but the location is not benign because it can cause all kinds of damage. If it gets big enough, it'll compress your brain, and it'll also compress your facial nerve, which is the nerve which controls the whole front side of your face. Like if you've seen Bell's palsy, that's usually a transient damage to the facial nerve. Well, they did an audiogram on him, and they found he had a 20% hearing loss that he was not aware of. And that's the only sign that he had a tumor. And then they said, well, we're going to do the surgery, take the tumor out. You will lose all the hearing in your ear because it's the nerve that goes to your ear. But if we're lucky, we'll be able to take it out without damaging the facial nerve, and you'll still be able to be an actor. And so he gets in the recovery room afterwards. He's happy because his face is working. They apparently managed to catch it in time to spare the facial nerve. And as he's getting ready to go home, his whole face just droops. And apparently there was some injury to the facial nerve. And he spent the next 9 months going for acupuncture treatments. And 9 months later, his eyes started wink, and his whole face came back. It took that long for the nerve to regenerate itself, and
Wow.
and his career was saved. Now, if he'd have not known about the tumor until it was so big that he was deaf, it probably wouldn't have worked.
Yeah. I wonder, any idea whether his hearing did come back or he did lose it?
Oh no, the hearing's gone. You take the nerve out,
Right. Okay. So he's only got hearing in one ear.
Yeah.
Yeah. Interesting having an acting career like that, being like completely deaf on one side. Yeah.
Well,
I know
and
many.
if you had only half a face, you wouldn't have an acting career. So
Yeah. Or you could play certain characters, I guess.
yes, like one of the villains in the Batman movies was Two-Face, who had one face that was normal and one that wasn't. Yeah, or the Phantom of the Opera. You could do that. Yes.
Yeah. Many years ago, I had my 4 wisdom teeth out at once, so they gave me general anesthetic, knocked me out, and the surgeon warned me before, and I had to sign a disclaimer. He said, when you wake, your bottom lip will be numb. It will feel like you've just come from the dentist and we've injected it.
Yeah.
He said that will last anywhere from 5 to 10 minutes to an hour or two to a day or a week, or 1 in 100,000 chance you'll have it for the rest of your life.
Yeah.
Sign here that
Fine
you
here, yeah.
understand that. And so when I wake, of course, my bottom lip's numb and I'm like, come on, go away. But fortunately, after a couple of hours, it went away because you
Yeah.
just feel like you're dribbling when you're drinking. And yeah,
Oh yeah,
yes.
not fun. Yeah.
No, no, to go, to try and adjust for that for the rest of your life. Um, Something that when I first discovered your work, you were talking about frozen shoulder, and I very much related to that because many years ago had had two frozen shoulders. And so here we're talking about things that are physically debilitating. And I guess I was fortunate. I had one at a time. I had one and then it went away and then the other one hit.
That's the usual sequence. Yeah.
Yeah. So do people ever get them at both going at the same time or
Well,
not normally?
and they're not identical at the same time, but you'll get someone who's and a lady just on my frozen shoulder healing group today just said, "Oh, my left shoulder's finally getting better, and now I can feel it starting my right shoulder." So it's like, and that happens about, unfortunately, 30% of the time, which is pretty bad odds in terms of getting a second one.
Yeah. And so the theory behind it, it's potentially emotional. We're feeling we've got the weight of the world
Well,
on us.
yes, emotional burdens on the shoulder. And there are predisposing risk factors which cause your whole body to be more inflamed. And that's the obvious explanation for why it occurs in so many women going through menopause is estrogen has an anti-inflammatory effect. So when your estrogen goes down, your overall level of inflammation goes up. Now, that doesn't explain why it's in your shoulder. It could be anywhere else in your body. But the other two risk factors are diabetes, which the sugar, when it goes up in diabetes, actually is pro-inflammatory. And so sugar causes inflammation throughout your body. And then some people have autoimmune disease like lupus or rheumatoid arthritis or Hashimoto's or thyroid, any other thing. And that gives your overall body a higher degree of inflammation. So those are the risk factors. But no one's ever really explained, well, why is it the shoulder? Oh, the shoulder's been called the emotional joint. It's carrying all these burdens. And I also deal with other chronic pain patients, and it's a different condition in general. Chronic pain, like back pain, that can go on for the rest of your life. You have multiple surgeries and it never goes away. And, but frozen shoulder will eventually go away in a couple of years. But it's an agonizing few years. And one of the challenges with the people on the frozen shoulder group who are looking for either the best drug or the best injection or the best surgery is to persuade them that there might be a psychosomatic component to this, that there's an emotional burden that you've overlooked. And it's different than, say, fibromyalgia, whereas I can do an MRI scan on someone with fibromyalgia, you see nothing at all. There's no inflammation, there's nothing. But if you do a frozen shoulder MRI, you see the inflammation throughout the joint. So it's actually, as a somatic metaphor, it's actually manifesting in a physical form. And when the surgeon goes in there and does an arthroscopic capsular release, which is one of the options, the synovium is literally described as angry red. So that's like the best emotional metaphor you can think of. We've got angry red synovium. Well, we're just going to strip that out of there. And that's what they do. And it's a pretty brute force approach. And you might ask, well, if you strip it out of that shoulder, is it going to come back in the other shoulder? And that's why I recommend people do the psychosomatic emotional work to heal this shoulder, and probably in the process, prevent the other shoulder from having to carry that burden. So that's my general approach.
Yeah. So is it potentially their emotional state where they're taking on stress, worry, the burdens, necessary or unnecessary, and they're releasing some chemical in their brain with those emotional states, and that chemical's getting caught in that part of the body, in the shoulders? Is it something like that?
I suspect that the chemicals are probably being released. It may be triggered in the brain in the emotion, but the chemicals are happening right in the shoulder, and I don't think the chemicals travel from your brain down to, I think they're created right there, as the metaphor is being made
Yeah.
physical. And I think the earlier you deal with the emotional component, the better. But unfortunately, many people go for weeks or months not knowing what the problem is. And then when you ask them, well, what was your emotional state when it first started? The memory's faded, and it might be some trauma they don't even remember. So it's important to see if you can get access to that, because many people are really angry that their frozen shoulder is limiting their life, but they never consider, oh, maybe I was angry right before it started, and that's how it showed up. And it takes, a week or two and I think it has to be really repressed anger, so that you're angry, but there's nothing you can do about it. That's the worst part. Now, I don't know what your experience was when you had, what was your emotional state when you had yours?
Well, I was running a business at the time and it was 7 days a week and it was 16-hour days. So I did feel like I had the weight of the world on my shoulders. And I felt that, anything that was an issue or a problem financially or whatever, like was just for me to deal with and not share with others so that others wouldn't be concerned. So, and there was always enough cash to pay for everything, but often only just. It was jiggling and robbing from Peter to pay Paul at times to keep cash flow occurring, and business would be down a bit, or we had a small 18-room hotel, restaurant, scuba dive business, and you'd have a
Mm.
big booking coming, and you knew they were coming next month. And you're like, great, there's some good cash flow, and last minute they might cancel, and you're like, oh, geez.
But
Because we got
yeah,
very, very few last minute bookings. So it was always, this was planned 3 months ahead and a month out it cancelled. And it's like, oh, the chance, so you just, things like that would happen and I would take a lot on. And I guess I was sort of like a duck, just floating on the surface and no one could see my little feet paddling away under the surface, 100 miles an
and
hour.
so one of the shoulders started first, and then the other one, or how that worked?
Yeah. Yep. Yeah. They both went eventually. I remember like the car I had at the time didn't have central locking, and to reach across
Oh,
and try and unlock the passenger's door, or to reach into the back seat for something, if I would forget and I would just swing my arm and shoulder around, it would be excruciating, and you'd
but
wake in
people describe,
sleep.
the women describe it as worse than childbirth. I don't have anything to compare it with, but that's how they
Wow.
describe it.
Wow.
And what back then? What did you know to do about it? What did you? What was your experience with treating it?
Well, zip, because we were living on a remote island in the middle of the Pacific Ocean, and there was a hospital and doctors there, but very limited, their experience with that specific thing. So I didn't even bother going to the doctor. When I did travel back to Australia, I had a good sports medicine doctor who I'd been to, and I'm trying to think, he had treated me for tennis elbow once and
Uh,
given me a cortisone shot in the
yeah.
elbow, which he complimented himself before he gave it to me. He said, "I'm very good at this. I've got a very fine needle." He said, "You're going to help make this work better. You have to pinpoint exactly where it is." And we actually got a pen and put a tiny dot where it was,
Yeah.
and then he injected, and it wasn't too bad. And the cortisone shot relieved the pain in the elbow for many months. And I can't remember. I don't think I had ever had a cortisone shot in the shoulders, but I do remember once he sent me for an MRI on my shoulder, and that was horrible because they stuck me in, and then they put little wedges under my shoulder, which made it
Yeah.
very uncomfortable. Then the guy pulls me out, and I'm thinking, great, it's over. And he goes, okay, now put your hand up on your shoulder and flick your elbow up in the air. And he put all these other wedges under, and then he's trying to push me back in and I couldn't
Oh,
get my elbow. And I'm going, mate, I
no,
can't.
no
And
way.
he goes, you have to. And I'm like, oh, this. He goes, it'll only be 5 minutes. Well, it was about like 15 minutes, and I was just in agony with that. I'm like, I've come here to get help, to get pain relief, and all you're doing is making this 10 times
Yeah.
worse. It was like,
Oh,
But
that's
that
brutal.
yeah, that MRI showed that I'd actually dislocated the shoulder, and I think I shared the
Oh,
story with you last time when we spoke, how I had fallen into the water when I fell off a boat, and
yeah.
yeah,
Oh,
yeah,
that's great. And
yeah.
some of the women lately have been describing uh, wanting to go and get their annual mammogram, and you have to be contorted into a position to get your breast in the right place, and they're like saying, never doing that again, or at least not till they're done with their frozen shoulder. So
Yeah, yeah.
it's brutal.
So,
So, and
yeah.
it's called the T Rex disease because people feel like Tyrannosaurus Rex with the short little arms because they can't brush their hair or comb their hair or brush their teeth or anything. It's like, and that's very frustrating.
Yep. Yeah. Yeah. Restricts movement, and you're in pain, and yeah, getting dressed, putting clothes on, all the whole deal. Yeah. And
So what
it's
I've found the most success so far for me is to use two things. Expressive writing is a science-based technique. If you just write down everything you're upset about, and then you do it on one shade of paper for 5 minutes, and then you just I have people read through it and tap while they read through what they've written, and then you put it in a paper shredder like Yoda's sitting on here, and just shred that to get it out of your body. It's like write it down, get it out, and then we'll do some more formal tapping protocols after that. So those two things together um, create the opportunity for the shoulder to heal. So
interesting. And while you're talking about EFT, something I meant to ask you earlier, I'm glad you brought it back up. If someone's listening and thinking, oh, I might try this EFT thing, what is, because I haven't formally ever done it, what's your advice? Should they go to a certified practitioner, or can they go on a YouTube video and watch and follow along?
most people start on YouTube. I've got a couple dozen YouTube videos on my website at larryburk.com or letmagichappen.com. And it's on a variety of things from shoulder problems to back problems to eating issues like food cravings and weight loss and asthma and sinusitis and grief. So all those things are on my videos, but there are literally thousands of videos out there on the web. My friend Brad Yates and Tapping with Brad, he has 20 million views. So many people start with Brad and go from there. And that works to a certain extent. And then if you get stuck, then that's when you go to a practitioner to help them fine tune the words you're using and the approach. And it generally, what a good coach does is listen to your words and help craft the statements that go into the EFT process. And usually, as a rule, the worse words you pick, the better you are. In other words, you want to, on a spectrum of I'm frustrated. Are you actually frustrated? Are you pissed off? Are you angry? Are you experiencing fury, or are you truly enraged? So you always want to go to the high end of the spectrum so you want that program to start running so you can tap it out. And then there are three secrets to success with EFT that Gary Craig, the developer, talked about. One was be specific. I mean, you can tap on, I had a terrible childhood, but it'd be better to tap on that thing my dad said on my 10th birthday. Those are specific events, and you get more bang for your buck if you do that. And then he said to be persistent. There's no side effects to doing the tapping. You can do it as many times as you want. And I recommend people with are really dealing with intense emotional issues, just keep doing it until you're exhausted. It's like, or you get bored with the process. It's like, then that program has been, deleted. And then the third thing is, if you're still not getting anywhere, do what's called emphatic tapping, which means scream or cry when you're doing it. That guarantees that the program's running, and that works even better. So.
Interesting. Yeah. So it's so the people will still have the memory of the event, but the energy of that event will be gone. Because if they've mulled it over 5,000 times since it happened 25 years ago, now all of a sudden for the 5,001st time, they'll be like, oh, yeah, I remember that, but it's no longer because I know I've had this with my wife. There was an event that happened to, that she got really ticked off about 40 years ago. And every year or two, she would bring it up and it was charged, like she was like, "Arr."
Yeah.
And then because when I started learning biotuning with the tuning forks and stuff like that, I came across a really wonderful practitioner that lived nearby. So I went and had a couple of sessions. I talked my wife into having some sessions with this lady, and she did. And when I picked her up in the car and we're driving home, she said, it's funny. She goes, I hadn't thought about this particular event that happened 30 years ago for forever. I can't remember the last time but she goes, while I was laying on the table there and she's going around me with the tuning forks, she goes, I remembered that event. And I went, oh, that's interesting. And I'm thinking, so I didn't say any more. I just let it go. And then a month or two later, I brought it up to her about that event. And she's like, yeah, what are you talking about that for? Like, I said, well, that used to really bother you. She goes, no, it didn't.
Oh, that's it. You know what that's called? Oh, in EFT, we call that the apex effect. And that's when you had a terrible experience, terrible trauma, and you tapped it away or released it with tuning forks or whatever, and it works so effectively, you forget how bad it was.
Yeah. Because we've been together 46 years. I know how charged it was back then. Like she was, it was with two other people. It was nothing to do with her, but she was close to one of the other two people, and she was pissed off to the max that whatever potentially happened, and it just used to really irk her. And now all of a sudden she's like, what are you even talking about that for? Like, and I'm like, geez, like.
Yeah.
So I was a waste of time me trying to convince her that she used to be really ticked about
No,
that.
no, you don't want to do that. You don't want to do that.
No.
You just want to be grateful because it's gone. And
Yeah.
my very first private client was a woman who was a court interpreter here in Durham who had failed the certification examination the year before or 2 years before. And her friends had all passed. She failed by 1 point. And she went a second time, the retake of the exam, and she walks in. It's the same examiner in the same room, and she just freezes and can't even get the first words out. And she was like Spanish language into English language was her task. And so her friend referred her to me and said, her test is coming up for the third time in a month, and she's paralyzed, And so we did some tapping on that last experience that was so traumatic, and I wind up having me give her English phrases and she repeating them back in Spanish until we tapped the whole way through it. And then I didn't hear from her for a couple of weeks. I asked her friend, did she pass that test? And she goes, yeah, she did. And then the woman came back to me for another reason a month later. I said, how'd the test go? She said, oh, I passed. I was never that worried about it. I was like, and that was my first experience of the apex effect. And it's the ultimate compliment that a therapist can get, but it still pisses off your ego. Like, oh, she should be saying, oh, I'm so grateful for you or healing me. And it's like, yeah. So.
Yeah, pass it off like it's nothing. Yeah.
And then, the final thing with the memory reconsolidation is when you've successfully deleted a file, then that's when we use hypnosis to put in the program that we want for healing, success, performance. And that always works better after you've done the EFT because you want to clear out a space for it in your brain to put in what you really want. And that also speaks to the whole metaphysical question of why don't affirmations always work? We all learn about affirmations and we watch the movie The Secret and make vision boards and the secret to the secret that they don't tell you is you got to really eliminate the negative self-talk first before you try to pile the positive self-talk on top of it, and which is why we do the tapping first and then the hypnosis, because the big problem with affirmations is in EFT is known as the tail ender. So you say, I'm healthy, wealthy, and wise. And then afterwards, it's but that's bullshit. That's not true. So that's the tail ender, is your objection that undermines your whole affirmation. And in hypnosis theory, whatever comes after the but is what counts. And everything before the but is negated. So essentially, you're just repeating that affirmation with the tail ender. You're just getting the negative stuff over, reinforcing that over and over again. So what you want to do is say your affirmation, listen carefully to the objections, and tap on the objections, so that the goal is you'll have a clean affirmation you can say, and there's nothing but silence afterwards. You actually believe it. So.
Yeah, interesting. Yeah, I was living overseas on a little island with no TV, no internet, no nothing when The Secret came out. So I'm one of the few people in these circles who's never seen it. And it's just like my sister sent me a letter or something like that at the time. She'd watched it, and she was like, "Oh, you've got to watch this, Doug. It's so awesome." I'm like, "Oh, okay." And I just didn't have the opportunity to. And by the time I came back to the real world, it had sort of, the momentum had gone, and it wasn't such a big thing then. And I just still never got around to watching it.
Well, there's various different versions of it now, and I have my own, what I call the let magic happen technique, which is you set your intention for what you want, you ask for guidance, you pray, but the thing that really triggers the universe to allow it to manifest is you have to let go. You have to say, okay, this is what I really, really want, but I'm letting go of it. Let it surprise me the way it manifests. And then to take it to the next level is what Dr. Joe Dispenza does, and many other of the latest new age gurus do, is you start to act as if it's already happened and be grateful that it's already occurred. And there's Joe sends out these, I did one of his week-long workshops a couple of years ago, and he sends out these stories of transformation every other week. And I always repost them on my Facebook page, because these are people cured my stage 4 cancer, cured my MS, cured my whatever. But there was this one that I just didn't resonate with me. I said, why am I listening to this? This is about a woman, 40-something-year-old woman, who wanted to be Miss Hawaii and win a beauty pageant. I thought, okay, well, I'll listen to it. And she goes, I was in Joe's workshop and hearing about his manifestation stories. And I thought, this is a perfect experiment. I've never been in a beauty pageant. I'm an older contestant, but I'm going to start acting like I won. And she sails through the whole competition, does extremely well, and wins. And her friends remark, that's really weird. When you won, you didn't seem that excited about it. She goes, oh, that's because I knew I'd already won. It was great. It was great.
Yeah, well, and true, like a 40-year-old woman these days would be challenged to win something. I'm not saying that's old, because I'm a lot older than 40, I'll tell you. But
I mean, just the response of like, oh, I wasn't excited because I already knew that I'd won. So it was just confirming what I already knew.
Yeah. Interesting.
Funny.
Awesome. Well, we've had some wonderful conversations today. I've loved some of the ways you've explained things scientifically. It helped me a lot. I'm going to have all of your contact details in the show notes so people can access your stuff. Is there anything that we haven't talked about that you'd like to mention before we wind up?
I mean, I've been doing coaching, on Zoom since the beginning of the pandemic, and it's a lot of fun. And I usually have people keep a dream diary, have them do expressive writing and tapping with me. And I've sort of narrowed, I work with a lot of people with all kinds of musculoskeletal conditions, because I'm a musculoskeletal radiologist. That I'm not a mental health professional, so I don't really seek out people with anxiety or PTSD. Although if I get a military veteran who wants to work with me, I'm not going to turn them away. I sort of distilled it down to, I want to work with people who want to heal physical illnesses, want to transform difficult emotions and enhance their performance in some way. So, because this works great for test-taking anxiety, any kind of public speaking anxiety, any performance issue. You just need to delete those old failures and put in what you want. So but I've narrowed my focus in the last couple months to frozen shoulder, just because I've got so many people in this frozen shoulder group who need to do the emotional work I've sort of narrowed it a bit, and I'm working on the second edition of the book will come out this spring sometime. So even though the website is now sort of focused on frozen shoulder, I still have lots of YouTube videos on other topics and lots of blogs on other topics as well. So I'd encourage people to keep a dream diary, and see it's the royal road to the unconscious. It's free and it's grossly underutilized in terms of when I teach EFT to psychotherapists and I'm in a room with 100 of them, I go, how many of you keep a dream diary? And it's like, 5 or 10%. And I'm going, didn't you learn that in training? Oh, we had a couple of days on Freud and Jung, and it was like, oh man, and so then you figure how many of their clients keep a dream diary, almost none. So it's a grossly underutilized. And there's on my website, there's a guide to keeping a dream diary. And the first thing I'm going to ask you to do is write down a question every night. Only one question, because any dream you have is going to be a response to that particular question. And you can keep asking the same question every night until you get an answer, and see what you get. And also say, treat your physical symptoms the same way you treat your dream symbols. It's your subconscious attempting to get your attention. And Edgar Casey said, nothing important happens to us that isn't foreshadowed in our dreams. So ideally, if you've got an emotional imbalance, so I'm shouldering this huge burden, you'll have a dream about it first. And if you start to handle the emotional burden proactively, you might prevent yourself from getting a frozen shoulder. But once you get a physical symptom, treat it the same way you would a dream symbol and say, okay, this is a message from my subconscious. And in Western medicine, we're just going to shoot the messenger, with a drug or an anti this or anti that. But you really have to honor it as a sacred messenger. And the goal, say with shoulder pain, and this is how I work now. I had left shoulder pain for 20 years, got divorced, it went away. Right shoulder pain for 6 months due to political anger, went away. And I sort of made this agreement with my shoulder. It's like, if you ever bother me again, it's going to be because I'm sitting on some repressed anger. And then I will start tapping immediately on my shoulder's really angry. I don't know why, but my shoulder's really angry. And then eventually it'll come to me what I'm angry about. And then an hour or two later, my shoulder will feel fine. So you want to make an ally out of your symptoms.
Right. Yep. Be aware
of it. It's all a feedback system,
Yeah, it's all trying to tell us something, whether it's in our dream or it's physical or whatever. Yeah.
And just honor the dream symbols. And if you don't get the message in the dream, and the message has to get louder in your body, well, pay attention and take action accordingly, and ask for guidance.
Yeah, use our intuition.
And if you're really stuck, go to a medical intuitive, and ask for a second. I would say that's a second opinion. Usually a good medical intuitive will confirm what you've already been thinking and take you to the next level.
Yeah. I went to a naturopath a couple of months ago, and we were talking about a few things, and I told her I had the podcast where, it's helping men develop their intuition. So about a minute later, she said to me, so Doug, you've got this podcast, you teach people about intuition. What's your intuition telling you about this thing you're talking to me about? And I'm like, smarty, I'm here paying you. And she was so spot on to do that. Her intuition was perfect at the time, because I knew what it was, but I didn't want to give up what I was consuming, because it was one of my favorites. And I was over consuming it to the max because it's my favorite. And I just knew, and I thought, but she was so intuitive doing that, and it was perfect.
That's exactly the kind of counselor you want to work with, because they want to guide you to come to your own conclusions.
Because you believe it a lot more then.
And oftentimes it's like, I had a reading with my spiritual counselor a week or two ago, and then she reinforced something that I was in denial about. And then at the end, I said, "Sound like my wife." It's like my wife knows these things, and I'm not going to accept it from her. I got to hear it from somebody else I paid $250, to. So.
Yep. Get the same advice you just got from your wife, yeah.
And hopefully the dreams will give you the info ahead of time. So yeah, I'd encourage people, and it's also fun to be part of a dream group or a dream circle and share that with. Or if you're in a family situation, teach your kids how to do it, and every morning at breakfast say, "Who had a dream?" And that would be just amazing. My daughter, when she was 3, kept illustrated dream diaries of all the villains and heroes in her dreams, and now she's a creative writer 30 years later. So,
wow. Interesting. Has she still got those from back then or not?
I wish we'd have to find them somewhere in my ex-wife's attic. So they're somewhere.
Yeah. Interesting. Yeah.
Excellent.
All right. Thank you for your time. That's been wonderful. Yes. And there's plenty of gold nuggets there for the men listening to dig out and improve their lives with.
Well, see if you can get PETA on your show.
Yeah. Well, see, 9 out of 10 people I interview are men, but she is someone that I would seek out. And
the other person, if you can get him, is Brian Broom. He is an Auckland, New Zealand, totally unique individual for the whole planet. He's a rheumatologist, immunologist, who, after a couple of years in practice, he said, "I think all my patients have psychosomatic illness." And he wasn't talking about fibromyalgia. He was talking about rheumatoid arthritis and lupus and the big ones. And so he went back and trained as a psychiatrist. So he's the only rheumatologist psychiatrist on the planet, as far as I know. And he runs a training program over there in Auckland on mind-body training program, teaching clinicians how to think symbolically about their patients' illnesses. So, and I can send you his, it's like wholepersonhealthcare.com, whole person health. I'll send you his website. You can see it's in his probably late 70s now, but he mentored me once on Zoom about 10 years ago. So I'll send you one of his articles. Really, really valuable.
Love that. Thank you for that. And if he's in his late 70s, we definitely need to bring his wisdom, continue bringing it to the world. Obviously, he's been doing it, but I'll definitely chase him.
He's written 3 or 4 books. He's gotten a whole bunch of articles, and it's just a brilliant perspective on all kinds of, not only rheumatologic disease, but all kinds of diseases, how they manifest in symbolic ways. And he doesn't do anything fancy like tapping, or he just does brief psychotherapy with people, and it works. He tells people, "We can give you all these expensive drugs, or you can do some psychotherapy." And some people choose one, and some choose the other.
Yeah. It's what you got your faith into, I guess. Yeah.
All right. Well, I will get you Brian's contact info. So.
Okay. Thank you very much. All right. Bye-bye.
See you.
Well, we're at the end of another thought-provoking episode. Remember to subscribe so you'll be alerted to new episodes. I want to say thank you to the men who are joining me on this journey of intuitive development. I truly hope our time together has expanded your reality and reinforced trust in your ever-reliable gut feeling. Embrace your intuition. It will not lead you astray. Until next time, stay tuned, stay curious, and trust your gut.